In this particular session of June of the online Golden Training membership, we're going to talk about mole removal, and we're going to present 3 case studies results, and for the first time we're going to release the full video with sound of these 3 treatments. So if you're interested in this particular 3 treatments that we're going to introduce to you for the first time in terms of sound, because these videos were already on our online training platform before, but we're going to release them with sound. So what we've got the feedback from people saying that they wanted to hear what was going on. So we're doing this in this particular online training seminar. So you'll be able to see the full procedure from start to finish with sound, which is very, very important. Up until a certain point we've taken the sound off, but what we realised is that if there is sound on, you can actually appreciate better what is going on, so you have a better context. There's just we'll share screen. So the screen is being shared and with all participants. So what we're going to do, we're going to go on to the first presentation and slideshow. Now this is an online training on mole removal and is going to be published on vortecplasma.com. Now moles can come in different shapes or forms. It's very important to only treat those moles that are benign. That is very important, and we actually provide a bit of information on our website about how to distinguish them. However, if in doubt, always go and refer your client to a dermatologist. That's very, very important, because moles come in different shapes and forms. Then normally moles, not normally, traditionally they've been removed using a scalpel. Then they've been removed using, after the introduction of lasers, people have started using lasers in order to remove them. We've got this repeat in this presentation, and many apologies. And lately we've got voltaic arc or voltaic plasma or electrical arc in mole removal, which is extremely successful for many, many reasons. Number one is we'll see that in the case studies very shortly anyway. We're just going to jump on that later on. So moles and birthmarks normally appear within the first 20 years of our lives. Normally they're not dangerous at all, but if they change in shape and form, and there's a few risks, and then there's a few things that you notice about them, then they've got to be checked immediately, because some of the cancer associated to growth on the skin can be extremely aggressive and dangerous, and sometimes not even treatable, successfully treatable, like especially melanoma. Now the traditional method of removing birthmarks is just by using a scalpel. This is a very old-fashioned way because it's not used any longer in aesthetic purposes, because it almost always leaves a scar. Scalpels are quite difficult to be used with a high degree of precision, therefore they're more likely than plasma or electrical arc removal to cause a scar. So when you remove moles for aesthetic purposes, what you're trying to do is just remove them without, if possible, leaving a scar. And this is unfortunately not always possible, is you have no complete control over that. One of the most important things is the aftercare. Now mole removal using lasers are as easy almost as using electrical arcing. The problem with lasers is that they're more expensive, the electrical arcing devices normally, and you have to learn a lot more, much more. I mean, the learning progress of process and learning curve in order to use lasers for this application is much steeper than electrical arcing. However, they're quite laser moles removal is quite effective, and they also, if done properly, they also minimize the risk of developing scars. And once again, it is never mind how you remove moles, the risk of scarring can always be there, and they can be minimized but never removed altogether, because the risk of scarrings are also tied to the recovery period, the healing progression, and how well the area heals. And there's some infections if people use the wrong products after the procedure, during the healing progression, then there could be scars. The likelihood of developing scars increases dramatically. So that is out with your control. You've got a certain amount of control. This is why we tell you to always hand out post-treatment leaflet where you detail exactly how just a second, I'm just going to mute the sound here. Exactly how they have to take care of the mole. So that leaves a lot of that removes a lot of doubt from your customers, because if they don't have that information in writing, then they may find other solutions in order to take care of the part, and that can actually result into some poor healing, or sometimes even infections. And then when there's infections, the likelihood of scarring increases dramatically. The technique is, even with lasers, is to flatten the moles as much as possible, depending on the benign growth. Some benign growth go inside the skin, so they have to actually be rooted up until inside the skin, like some thalasma. Some thalasma is one of them, but mostly just it's just a simplistic approach what I'm talking about right now. Whenever you're not sure exactly what type of moles you're dealing with, if you're in doubt, always refer the person to a dermatologist to make sure that you're not touching anything that is potentially cancerous. So if you're not sure what type of mole it is, and you're sure that is benign, then the best thing you can do is just level off that mole with the surrounding skin. And that is done also with electrical arcing. You can actually see loads of videos online that we've published about removing this sort of lesions using this technique and leveling off the moles with the surrounding skin, which actually produces very good results normally. So the technique is normally used as the spray operation. If the benign lesion is rooted between the dermis and the epidermis, a slight deeper ablation may be required. One of the examples, as I mentioned before, is sand thalasma removal, because sand thalasma can be a bit deep. And you always start from the top and work all the way down. I mean, to people who have started these aesthetic treatments lately, it seems as if it's quite common knowledge, but in 2010, up until 2010, this mole removal by using electrical arcing without the scalpel is something that was almost breakthrough, because up until then the main procedures were either using a scalpel or using a laser. Lasers are very expensive, so this has brought down the mole removal process for aesthetic purposes. They brought down the cost of the mole removal process down dramatically. It's extremely good. So once again, I can't emphasize more how important it is that you make sure that the moles that you're treating are benign. Some people, some professionals prefer to have a proof from a dermatologist saying that, dermatologist statement or something in writing stating that these moles are benign. That is not always the case, so you can actually, from a legal standpoint, you can build into your consent form saying that what you're treating is supposedly, well, is assumed as benign, and it is the customer's problem to the customer's duty to make sure that they are benign, and they have gone to a dermatologist first to make sure of that. It's very, very important you do that. If you want to, we've got also this sort of documents already there on beautytech.com, so you can actually copy paste and adapt them to whatever business you have. So we tend to publish all the information we've got because it's always frequently asked questions, so it's much easier for people to access directly onto the internet. Always remember to use a numbing product. It's not because it's mandatory, it makes the job much easier because these procedures can be painful. So that is very important as well. Normal, if you're a medical practitioner, in many countries you can use up to 20% lidocaine based creams, and these are quite good. Always remember to hand out some aftercare information. Again, if you don't have it, if you're a bit confused, go on to the beautytech.com website, you'll find that is there on public domain for everyone to use. Because what we find is that people were actually skipping around, couldn't find it, and they kept asking the same information over and over. We made that available. You don't need any password. You just go there on the beautytech.com website and you'll find this particular aftercare information. So you copy and paste. Now, this is very, very, very interesting indeed. For the first time, we're going to release the video with sound of this particular treatment. This particular treatment was carried out in 2014. In April 2014, and I remember it vividly. And we seen the same person in 2016. Yes, it's actually over 2 years after. This is the result, completely disappeared. We've got a number of pictures of this particular person. This particular person was 20 years old in 2014. Absolutely beautiful. With a number of benign moles that she wanted to have removed. And as you will watch in the video that we're gonna edit in this video with sound, this procedure is quite easy. Since they are benign moles, legally it does not require a medical doctor to remove them. That is quite important to emphasize. We've actually we had lots of controversy over it up until today in Europe. As long as you're not treating diseases, and a benign mole is not, there's no restriction that we know of in the UK about who can remove them legally. So it's not as if you're going to remove a mole on somebody that is benign, you're going to get arrested, you're going to face legal consequence after. But it's very important that you put those consent forms in place. It's very, very important. So keep them for your peace of mind, and to avoid any problems in the future. So I can't actually emphasize more how important they are. Even in our case, because we had them in place, many, I wouldn't say many, just the few people who tried it on couldn't actually try it on, but not in moles removal, in other treatments, and everything is fine. So make sure you have consent forms in place, because when a lawyer tries to, they test you, they want to, the first thing they ask you for is the consent form. Make sure you have them and you keep them on record is very, very important. That. And so, numbing product that was used on the day, if I remember well, was a numbing product. So we're actually going to watch into the video. I think it was a 20% lidocaine. I can't quite remember, but the information is there on the case study, which you can actually access on vortexplasma.com. Since medical doctors historically have done this sort of procedures, which are very simple, now people buy plasma pencil lines and do it themselves at home, so they're taking loads of doctors' work away from them. Before, doctors used, because they like injected with lidocaine, the area with lidocaine to numb it. This is unnecessary. It's just like using a bazooka to kill a bird. You wouldn't actually do that. So you would actually use you wouldn't use a bazooka. You use something much more smaller than that for that particular purpose. Sorry for this particular comparison, but just to give, it's like it's just too simple a procedure to inject someone with lidocaine, even for a doctor. So if you just use a numbing product, and even if you're a doctor, you buy something on the internet, the numbing product on the internet, use occlusion, even that is good enough, occlusion for long enough. So there is no need to inject lidocaine. Is an overkill, is only a mole, and we've seen it over and over and over again. All you need to do is just numb the area, and in order to numb the area, you can use numbing products. If you're a doctor, use a 20% lidocaine based product. It's quite quick, not because it's better, but it's quick. It doesn't require occlusion and so on. But injectable lidocaine is just an overkill. You would actually try to it's just too much. Again, I made that comparison. I'll try to make other comparisons. It's just simply an overkill. That's really it. Again, if you're thinking like I don't know, you have to make a meal for 100 people, then you're going to use a huge kitchen. But if you have to make a meal for 2 people, you wouldn't use a restaurant kitchen, you would use your house kitchen. It's just something of the sort. You wouldn't actually use those resources. Again, lidocaine has got, also lidocaine injectable has got some counterindications. It's got some risks, very low, but some risks associated to that. So instead, if it's on a numbing product, the risks are lower. So again, even if you're a medical doctor, no need for injectable lidocaine. You are placing that person to an unnecessary risk, although very, very low is unnecessary. An injectable lidocaine and a numbing product which has got lidocaine, obviously an injectable has got more risks associated to that, to the numbing process than a numbing product itself. So no need for injectable lidocaine or injectable anesthetics, local anesthetics. But historically, it's been done using injectable anesthetics. There's no reason whatsoever in 2018 to actually use injectable anesthetics, even for medical doctors, even if you can do it legally. Now, and this is the result. This is the before and after. Absolutely amazing. I couldn't even see when I actually taken that picture, I couldn't even see a trace of it. It was absolutely amazing. Now, adverse reactions, which is mainly due to infections, are due to a poor aftercare. So make sure you do provide that essential aftercare instruction to your clients. Again, then if the scabs are removed forcefully, then it can cause scarring problems. And sometimes some people can have different skin reactions. It's just the example for of people with the propensity to developing keloids. So if people are likely to develop keloids can develop after this type of procedures. And yes, so another before and after, absolutely amazing. And that's pretty much it. So right now, what we're going to do, we're going to show you the full video with sound of that procedure in 2014. Enjoy the video.
Dochodząc do poziomu skóry redukujemy.
No, we can go higher, but we'll try a 12 and see how she can tolerate it. Go higher.
It's too small, I think. Yeah?
Now it's higher.
Ale problem będzie, że nie ma... już, tu jest. My gosh.
To rzeczywiście jak jest.
If you will be so kind, awesome. Thank you very much.
Tam są tętnice.
Nie mów tak. Ja miałam skarpę w ręku.
Tylko nie na zasadzie ostrza, nie?
No. Żebyś sobie nie złożyła tylu.
Ale wiesz, to będzie w zasadzie koagulacji, to od razu.
No, to od razu się zasklepi. Okay.
Tego?
Boki.
U mnie czuję tak.
Okay, good.
Telefon komuś.
Tu chyba gdzieś.
Oj, przeszkadza.
Nie, dzwoni.
Białe.
Dzwoni z telefonu, bo...
Nie przeszkadza. Je przez cały czas są 3, nie były zmieniane, także...
Czasami tutaj jest taka skóra też śniada, tak powiem, dosłownie jak miśpardy, tak jak brązowe takie.
To słabo trochę jest, no.
Jesteś?
Nic nie czuję.
Dobrze.
Wystarczy.
Dobrze. Pani Haliko, mogę Pani dać telefon? Niech Pani sobie spokojnie patrzy i rozmawia. Halo?
Halo, dzień dobry. Z tej strony Pani Napoleon. Proszę
Jeszcze jedna.
Pani Ewunia.
A z jakim problemem już nie muszę?
Jezus, za bardzo może Panią duszę, co?
Nie, okej.
Już szerzej, a potem znowu. Powtarzasz,
Tak, tylko że
ścierasz,
tym-
powtarzasz, ścierasz.
Tym mniejszym
Widzę, że Pan
to już
tutaj
tak nie idzie.
już Pan jest instruktorem. Dobra.
Every day you are doing better.
No właśnie. Obrać.
To nagrywaj teraz. Ole, Uga. Tu masz ten. Ty musisz blisko, bo jest szkło, wiesz? Bardzo blisko, to jest makro. Musisz widzieć ostrość.
O. Czyha.
Nie za
Okay.
dużo.
Okay,
Nie nad okiem.
Trzymaj.
Trzymam to pani nad okiem i czuję się z tym bardzo źle.
Trzymam.
Aha, teraz przesunięte.
Nie,
No.
po prostu o, żeby
Aha.
Pani, jeżeli można, Pani siadła z tamtej strony.
Dobrze.
O.
Przesunięte.
Ja też się źle czułam, jak pan zaczął najpierw tutaj, od
Aha.
razu.
Że to Pani widziała.
Tak, że najpierw było. A nie tak, od razu.
Masz.
Nie, ja nie chcę nagrywać, bo ja... Tak, jasne, bo troszeczkę też używam tego, że Panią nie boli, więc że jestem
że jechaliśmy gdzieś i na przykład część ulic była pozamykana, bo te, przynajmniej to wyglądało na tych takich, tam jest taki
Bardzo przykro.
Nie, skąd? No ja tu już jestem przecież weteran, już miałam raz
Tak,
dzieckiem.
tak.
Ja
Pani,
zazwyczaj te usuwam wszystkie, te małe. Właśnie takich dużych niestety się boję.
Małe Pani, what do you think?
Good. Carry on. Don't worry.
No bo przecież
Just
to jest
use it as if you're spraying.
To jest to, co
As if
to
you're
wszystko
spraying
posiada
over.
jest pani.
As if you're spraying over.
To granicy
Dobra, moje też się porusza wtedy tutaj brzuch.
So you can continuously spray over it, continuously. You don't need to put dots. Just continuously
Okay.
go over it as if you're spraying.
Czyli nie kropkami, tylko ciągle.
Like this.
Masz recepturę, Marcinku, spróbujemy
Mam,
sobie zamówić.
tak, mam spisane.
Boli?
Kasiu, jeszcze-
Razie jeszcze czego pokażesz Pani Marginie Lubeksy.
Yes. Come.
Nie, tutaj
Węgiel leży.
i trochę. Tak nawet mocniej. To nie może, żeby to zetrzeć. To co Pani... Balona. Tak, dokładnie. Co teraz Panią? Ale nie, dobrze, wszystko w porządku, tak? Nic się nie dzieje.
Likely there's not going to be any marks
Okay.
once it heals. Say in 2 months' time you cannot see anything. You shouldn't be able to see.
But are you sure? Because look, here is some blood, okay, but there is a bit brown. The color is a bit
I
brown.
would leave it. I would leave it. You can go again later on if you want.
Okay.
I would personally leave it because then the patient is going to get back and I think if you just
Now, we're presenting this other case study. This is a very interesting case study. We're just going to go into the picture so I remember it. And again, it's a very similar number of moles that we have removed. And once again, this is a very good case study because not only can you actually enjoy the full procedure soon after this short presentation, but also you can actually watch the healing progression of after this this aesthetic procedure. In this particular case, we use a 10% lidocaine numbing product with occlusion. So it is always advisable whenever you can to use a stronger numbing product only for to be practical, because the numbing products that are available online or off the counter at the chemist are normally low concentration lidocaine, and they require occlusion, and that takes time. So make sure you've got a very good numbing product that is fast acting. And if you use a 20% lidocaine with other product active ingredients, which we've got listed on voltaicplasma.com, you'll find the effect, the numbing effect is absolutely amazing, and it's fast, and you can actually feel the pain at all. Now, this is the before. These are the mole. There was a mole in there, the mole in there, and this is another picture. So this is 10 days after the procedure. You can see there's still a sign of it. 14 days after, still some signs of scabbing. 10 weeks after, can't even see it. Zero, nothing, zilch. So the effects are absolutely amazing. So for now, what we're going to do again, we're just going to show you this particular full procedure with sound for the first time. So enjoy the video.
No łaska. Any better, but...
No, it's our laser. It's big. It's a sound of.
I was just looking at the screen. Super, dziękuję bardzo. Okay. Boli? Okay.
I don't feel nothing.
Perfect. Super. I'm going to increase the power then.
Byłam zdziwiona pytami.
Super.
I feel like
Yes, as long as it's not painful. Okay? Can I carry on? Can I carry on? It's too
A little
painful.
bit.
When it's too painful, please let me know. I'll stop. Okay? Okay. Just stop me. Stop me if it is too much, okay? Quindi, what I'm doing here is very simple. I'm burning it from the top, and I want to level it with the surrounding skin. Please stop me if it's too painful.
So you do the little circles, wider and wider.
Yeah, I'm burning it from the top.
Uh-huh.
Okay? Body?
Nie.
Nie. Nie means no.
Yes, definitely.
Okay? Stop me, okay?
It's everything okay.
Oh, beautiful.
Se
I want to make
passiamo 2 volte nello stesso posto, non guasta.
No, quello che facciamo, abbruciamo dalla superficie, dalla parte
Ok,
superiore, ok?
bordino, sto
Ah.
vedendo.
E la dobbiamo fare diventare piatta con la...
Ok. Zmierz.
Ok?
Chcę spowodować, żeby spłyciło się, zrobiło się płaskie. Dlatego z góry. Jakby piłował.
I czy wszystkie zmiany takie wypukłe można, czy są jakieś...
Come distinguiamo quello che possiamo fare e quello che non bisogna toccare?
Se lì da tanto tempo normalmente vanno bene, però ora vi dico come l'abbiamo risolto questa cosa. un attimo,
To
solo
teraz
che-
powie jak. Z grubsza, jak coś jest od dłuższego czasu, to można.
Posso continuare? Possiamo avere un altro di questo, grazie. Dziękuję bardzo. Ups. Dziękuję. Super. Anything else? Just that one, yes?
Ultimo qua.
This one, is it? No. This. Perfetto.
Grazie.
Dziękuję bardzo.
Jest ta pizza? Nie ma.
Very nice.
Jak będzie dzwonił mój telefon, to odpisz, bo to może dzwonić ktoś z pizzy. Jak trafić?
W ogóle jest dźwięk? No tym razem jest.
Dźwięk jest, tak?
Na Messengerze ma ktoś pisać? Czy
Nie,
będą dzwonić?
to telefon normalny.
Boli?
Nie? No.
Boli? Super.
Wypalany.
No.
Very fast.
Żeby ogniem przypiekało. Finito questa? Credo, piccolo. Sembra tak jest, no?
Nie wiem, nie czułem.
Perfect. Finished. Let's go. Then I've got this one. Super. I'll keep this thing here.
A to jest jakieś przetestowane, czy tak?
Nie, wiesz co, łapią z ulicy i palą.
Nie no. Tak tylko z
Anglii.
zapytaniem, czy później faktycznie znikają te ślady.
Tak. No Kasia Muszlicka miała pod nosem robione, nie ma śladów.
No.
Miała takiego sędziego pod nosem. Poza tym to wszystko zależy od skóry, bo moja Julia ma taką skórę, że jej po ospie, jak miała 3 lata, też gdzie ślady zostały po ospie. Po prostu ma taki rodzaj skóry, że wszystko, ten zadrapanie widać tam.
Super. Anything else? Just that one, yes?
Ultimo qua.
This one, is it? No. This. Perfect.